my name is Hannah Redfern. I'm currently an arrhythmia nurse specialist here at the LGI. However, that's a new role. I was previously on ward L19 as a staff nurse. So it's a specialist assessment that we have to do for every patient that gets admitted as an inpatient, and it goes through different questions just to basically gather what the patient's particular needs are, to identify any areas that we're going to need to support the patient with whilst they're in hospital. And one section of that is surrounding patient safety at home. Specifically, we ask patients if they're feeling safe at home, if there's anybody that's controlling them or making them feel unsafe. So we ask that to every patient. It can be a difficult one to ask because sometimes you can garner off the patient whether you're feeling intrusive or something like that. So you do have to kind of tailor it to each patient, I find. Like, it is a scripted thing, but I think it's better to tailor it to the patient that you're with. So I've come on shift for the day shift, and we've had a patient being admitted overnight, and one of my colleagues had actually gone through the nursing specialist assessment with this lady, and this lady had flagged up that she didn't feel safe at home. My colleague did a little bit of questioning, but because it was in the middle of the night, it didn't feel appropriate to kind of go down that whole route. She was tired, she was in pain, so it got handed over to me that we have a patient that's at risk and for us to deal with it appropriately. I obviously went and introduced myself to the patient, took my morning medications, and then allocated time to be able to go and sit with this lady and get more information about what was going on. I sat with the lady, and she was very visibly emotional and upset. So I think my first priority was just to make sure that she felt that she was in a safe space, to reassure her that she'd done the right thing by disclosing, because obviously you could be the only person that they've ever disclosed it to, and it can make them feel very vulnerable. So I think it was really important I just made sure that she knew that she'd done the right thing, and that was going to make sure she was safe. And then the next thing I did was ring the safeguarding team to make them aware, and to find out exactly what I needed to do next, to make sure that we were able to make sure that this lady didn't slip through the net. With the help of the safeguarding team, managed to speak to a few refugees. Obviously, with the COVID situation at the minute, spaces are very few and far between. It would be that she was going to have to go out of area, so I had to speak to the lady about this, to see that she felt this was something that she could do, and reassuring her all the way through that we'd support her through that. And thankfully she felt that was something that she was going to be able to do. As it turns out, on discharge she ended up going to a hotel in Leeds, so she did get out of that situation. I think obviously it's an emotional thing, but I think the overriding emotion for me was I felt really privileged that I was able to be instrumental in helping this lady get safe. So I felt really a mixed bag of emotions. Obviously devastated that this lady was experiencing this, but really happy that we were able to make a difference for her.